And welcome back to American Agenda. I'm Joe Pinnan along with Amanda Vilhante. Well, people are calling it a CDC flip-flop. According to the CDC, fully vaccinated people need to begin wearing masks indoors again in places with high COVID-19 transmission rates. Now, the agency is also recommending kids wear masks in schools this fall. But where's the science on all of this, and why did we even bother to get the vaccine if this is in fact the case? Joining us now to discuss is the CEO of GeoVax, David Dodd. So, David, I want to take our audience back on a timeline. Initially, we wanted children to get the vaccine because we wanted to ensure that they were not going to transmit to the grandparents that hadn't gotten the shot, the parents that hadn't gotten the shot, while we waited for the shot to be available. Now the grandparents have gotten the vaccine. Many of the parents have gotten the vaccine. The teachers, many of them have gotten the vaccine, all who want it. And suddenly we're still requiring them to wear the mask. Where is the science in all of this?
Well, I think that the science is actually being masked by dubious special interest, to be honest with you. There is no scientific basis in consistent and full support for this recent recommendation and the rhetoric that's surrounding it. There just isn't any.
Now, David Dodd, I think that's an interesting point you just made right there, that this is a recent recommendation and there's no science behind it. And I also want to point something out here. I want to bring up a map where we can see where the hotspots are of this COVID transmission. And as you can see, this red color, now this signifies a higher recommendation area. And as you can see, that's a large part of the country. So when it comes to students and they're telling them to wear masks in classes again, how do we protect them? And how do we protect parents and, like Joe was saying, people who are at a higher risk?
Well, first of all, we've had millions of people that are continuing to come into the country without any documentation of either being tested or being vaccinated. And yet these are the same areas where you're seeing the greatest increases in COVID, and certainly it's largely been driven by this Delta strain. So there is information there that hasn't really been well addressed by public health authorities and certainly by government authorities. We haven't seen that happen. Now, relative to children, again, I think we need to remember that they are at such a very low risk of either being hospitalized and certainly from a mortality standpoint. And so from that standpoint, from the perspective of vaccinating them, we need to continue to communicate, and I emphasize on a more positive nature rather than a threatening nature, to increase vaccinations. If you haven't been vaccinated, do give good personal consideration, make the decision that is best for you, but really look at that. I think this may change somewhat when we see the first FDA approval of a vaccine. I heard earlier today that it was expected to be by the end of August. Now, hopefully that will happen, but that'll add greater credence and sort of foundation for that, because there's still a strong body of people who are suspicious and distrustful of it because they are not FDA approved. I think we'll see the approval sooner rather than later. And relative to young children, I don't think necessarily, again, I'm not an expert in this area, but masking them, forcing very young children to wear a mask, I don't think is a wise solution. I think we need to make sure, as we've done, that most adults who will be around these children are vaccinated, and at the same time to be cautious in all other ways.
Absolutely. Quickly, got about 30 seconds here. You touched on it a little bit, but we have large volumes of people coming across our southern border, 1.8 million apprehensions, close to 300,000 gotaways, people who evaded capture. How is it intellectually consistent to actually get rid of the COVID policies on the southern border requiring people to be tested, coming from high transmission areas, while at the same time saying that the number one threat facing America right now are these large pockets of unvaccinated people?
Well, you make an excellent point, because intellectually it just doesn't equate. It makes no sense, because the very simple-minded, rational individual would say if someone's coming in, we need to first of all test them, and then we need to ensure that they're vaccinated. We should not just simply let them loose or ship them to areas. And what we're seeing is these are the very same areas that we're seeing such great increases. So, again, the rational person would think, I think there might be a connection there.
Yeah, I mean, we're talking about having federal workers vaccinated. In fact, like Google's CEO just announced that they're pushing back their work from home orders and requiring vaccines right there. So I mean, like you just said, we're seeing people come across the border and they're not being counted.
Absolutely.
Exactly.
All right, David. Yeah.
Natural immunities are not being counted either.
All right, David Dodd, we appreciate you. Thank you so much for joining us.